Hi everybody, I'm Parna again with you all with a new topic. Do you know about knee nerve damage? Now I am going to discuss about what are the symptoms of knee nerve damage. There can be a number of different symptoms of knee nerve damage, but the most common include is pain, numbness and tingling and feelings of burning on or around the kneecap. Some people may also find that they have a hard time moving the joint, or they may feel stiffness or dull ache when the leg bends in certain ways. Discoloration around the site of the damage is common too, particularly if the nerve damage was caused by some sort of trauma. A number of different nerves run through the knees, but diagnosing damage can be somewhat tricky. Symptoms are often really similar to other joint problems, including cartilage damage and issues related to arthritis. In general, medical professionals recommend that anyone who suspects they may be suffering from knee nerve damage get evaluated and treated. The body's nervous system is a complex series of chemical signals that course along the nerve pathways, bringing message about sensation and pain to and from the brain. Damage can happen almost anywhere and is usually a result of injury or trauma. Nerves can get pinched, served or twisted, and moving joints like the knee provide many different opportunities for this sort of injury. Local nerves can be pinched or squeezed fairly easily between the bones and ligaments that together form the joint. Some damage is obvious right from the start. This isn't always true, though, since the damage may not be immediate. Certain knee injuries build on themselves over time. A person may feel as though he or she has healed, but may not realize till later that healing has actually compromised the nervous structure, for instance, or a person may not even realize that there's been an injury at all till certain signs of nerve damage being appearing. Next, we are going to discuss about pain. Pain that seems to radiate out of the knee is one of the most common symptoms of localized nerve damage. This often comes in varying degrees and can alternate between throbbing and mild, dull aching. Sometimes moving the leg or changing the knee's position can alleviate pressure, but not always. A lot has to do with whether the nerve damage is accompanied by inflammation or swelling at the site, and how seriously the nerves were impacted. Nerves are usually responsible for carrying signals to indicate pain, and when they are damaged, they can respond in exaggerated ways, in some cases transmitting signals of pain that are disproportionate with the extent of the actual injury. Pathways that have actually been served, on the other hand, sometimes fail to transmit any signals of pain even if it would otherwise be warranted. The next point is numbness and burning. Another major sign of knee nerve damage is numbness or lack of sensitivity. Numbness may be localized in the knee, or it might radiate to the upper or lower leg. Some people also describe the discomfort as a prickly pins and needles sensation. Tingling tends to come and go, but is usually most common after periods of inactivity. People who have suffered these sorts of injuries sometimes also describe a feeling of burning just below the skin. Some of this is just perception, but in certain cases, there are actually local skin temperature fluctuations that go hand in hand with these sensations. The patient knee may feel warm to the touch, or in some cases colder than usually. Next, we are going to discuss about restricted movement. In many cases, nerve damage can also restrict a person's movement. Quick kicks, sharp bends and other extreme or rapid movements may be delayed or too painful to perform. This is usually a result of muscle constriction that happens in response to nerve signals indicating damage, which is to say, it isn't caused directly by the nerves, but it is nonetheless closely related. Patient with nerve damage to the knee may also experience weakness and immobility. This weakness may involve the knee or the entire leg. In some instances, the leg may buckle under and the patient may feel unsteady or lose his or her balance. Next, we are going to discuss about skin discoloration. It's also impossible for the skin along the top or back side of the knee to become discolored, but it is possible. A bluish tint surrounding the knee may indicate nerve damage, although the condition does not always cause this. Color changes are most common when the damage has been caused by a trauma that has otherwise left bruising on the skin, and in these cases, it can be tough to distinguish between specific causes. Next, we are going to discuss about diagnosis and treatment options. Injury to the soft tissue of the knee does not necessarily mean nerve damage has occurred. Ligaments or tendons may have been torn, but yet surrounding nerves may be left undamaged. Although physicians or other healthcare experts may recommend a magnetic resonance imaging (MRI) test to determine if there are tears of tendons or ligaments, nerve damage will not always show up in this imaging, and as such, still more testing may be required. In most cases, these sort of extreme measures are only taken if there is no other way to treat a patient's symptoms. Care providers often recommend diagnostic tests if symptoms of peripheral neuropathy are present, which are basically more systematic nervous system problems. A test known as electromyography (EMG) can determine if symptoms are related to knee nerve damage. From there, medical teams can come up with treatment plans. Sometimes physical therapy and rehabilitation can bring a person back to normal, but in other cases, more invasive therapies like surgery are necessary. It's not always possible to reverse nerve damage, and a lot of times the best that can be done is to mitigate the problem and stop it from spreading or getting worse. So friends, I think you all have understand about this topic. I will be again here with different interesting topics. Thank you.